morning. It's Jaed, right? Hi, I'm Ray. I was the nurse who was assigned to Miss MM last shift. And you are the nurse who will handle her for this shift, right?
Good morning, Ray. Yes, I am the nurse assigned for Miss MM in this shift.
Oh, okay. So, what do you know about this patient?
I don't know the specific details, but I know that this patient was just admitted last night.
Alright, I will be handing her case to you. So, let's start. Okay, Jaed. Miss MM is a 26-year-old pregnant woman, gravida 6, para 6. She came into the hospital on October 25 at 1 a.m. with a chief complaint of labor pain. She experienced frequent regular contractions at home and was brought immediately to the emergency room. So her vital signs when she arrived are as follows: blood pressure at 130, temperature at 36.7 Celsius, pulse rate at 80 beats per minute, and a respiration of 21 cycles per minute. And her oxygen saturation was steady at 98%. And the initial fetal heart tone of the fetus when she arrived was at 135 beats per minute. And the attending physician did an internal examination and found out that she was already 6 centimeter dilated when she arrived. And she was having an interval of 3 to 4 contractions that last for 4 to 5 minutes. And based on the partograph, the rate of her dilatation was normal. And she was fully dilated at 6 a.m. and at 6:45 a.m. she delivered her baby via normal spontaneous vaginal delivery.
Okay, so what were the doctor's orders?
At 1 a.m., the doctor ordered that the patient must be admitted under his service and that the patient's vital sign, including the fetal heart tone, must be checked every hour. We were also ordered to secure consent, inform the delivery room, and to start the patient at D5LR 1 liter with a drop factor of 30 drops per minute. The doctor also ordered that the patient should have the direct globulin test, and we were also ordered to monitor and record the fetal heart rate every hour and to report any unusual findings.
May I know the patient's medical and social background?
Okay, so Mrs. MM is a Roman Catholic. She is married and she is currently residing at Balulang, Cagayan de Oro City.
May I know her OB history?
So as I've said earlier, the patient is gravida 6, para 6. All her deliveries were normal and all were delivered at Maria Reina Xavier University Hospital. She had 4 full terms, 0 premature infants, she had 1 abortion and 1 death. And she has currently 4 living children. She has no history of eclampsia, hemorrhage, cord prolapse, placenta previa, or abruptio placenta.
Okay.
So the patient's laboratory results were taken yesterday and all of it are at normal values. Her COVID-19 RT-PCR result came back negative, and during the course of 1 a.m. to 6:45 a.m., the patient's vital signs were consistent at average levels and did not have any large fluctuations. Her BP are at range of 120 to 140. The temperature was consistent at 36 degrees Celsius. Pulse rate range within 80 to 90 beats per minute, and the respiratory rate ranged from 20 to 23 cycles per minute. And the oxygen saturation was steady at 98%. And also, the fetal heart tone were also consistent to be on normal levels ranging from 129 to 140 beats per minute.
So I guess everything went smoothly and there were no complications in her recovery.
Yes, you're right. So let's proceed to the medications prescribed by the physician. So here are the medications that the patient should receive. So let me read them to you one by one. So first, co-amixoclav, 500 milligram tablet 3 times daily per RM for 7 days. Mefenamic acid, 500 milligram capsule every 8 hours per RM for the pain. Ferrosulfate, 1 tablet once a day. And Conzace, 1 capsule once a day. So if you weren't able to memorize all the medications that I just said, Don't worry because I will leave in this chart the list of the medications that the patient should take. So don't worry. And before I forgot, the attending physician also ordered that the vital signs of the patient must be taken every 4 hours. Input and output must be recorded per shift. And IV to follow D5LR 1 liter at sustained release. And to report any unusual findings to the physician. So, were you able to catch up and take note of everything that I just said?
Yes, I was able to take note of them. Thank you.